All right, let's finish up with some diseases of the lymphatic system and then move into the functions of blood. So, primarily, the diseases of the lymphatic system, there's a whole offshoots, but the one that pops up the most is often seen as a symptom for other diseases, or a sign, so to speak. And that is edema. Edema is going to be when you have abnormal tissue swelling due to an increase in fluid. Now, this happens naturally all the time whenever you cut yourself, and most of the time you don't even realize it. More serious wounds, more serious injuries, you'll get more swelling, more edema. Think about when you roll your ankle. However, you can have zero outward injury and have a swollen ankle, swollen lower leg. And there are a variety of conditions based on the pattern and the type of that edema. Edema is seen a lot of times in high blood pressure patients, patients that have leaky capillaries, patients that have too little albumin, which is a blood protein, and in patients that have lymphatic obstructions. This is a version of edema called elephantitis, where you have one limb that is abnormally swollen, and this is all fluid accumulation. Moving into blood. So, blood, as a generic whole, is going to supply oxygen from the lungs to the cells, going to supply nutrients from the digestive system to the cells, and take metabolic waste from cells to the various disposal sites, such as with large intestine, kidneys, to name the two big ones. And then it's also going to be involved in transporting hormones to the various target tissues or organs, depends on the hormone in question. Blood is also going to play a role in regulating your blood pressure, or temperature. Obviously blood pressure, but temperature. It's going to be involved in regulating your pH of various bodily fluids. And in conjunction with the urinary system, is going to regulate blood volume to support the efficient circulation to and from various cells, tissues, organs, and systems as a whole. All right. Blood is also going to help prevent blood loss. We'll talk briefly about that. And then preventing infection and disease. We have a whole slew of white blood cells, complement proteins, and antibodies that are found in the blood, and they all work to protect the body. All right. So blood is made up of four main components. The first component is the liquid component, and the remaining three components are the cellular component or formed element. So the liquid component of blood is referred to as plasma. Plasma is going to be a mixture of water, various proteins, hormones, nutrients, electrolytes, respiratory gases, waste products, and a whole bunch of stuff. Of this stuff is dissolved into it. Plasma proteins are going to include things like albumin, that is the primary protein. It makes up 60% of them. 36 of that remaining 40% is going to be globulins in the form of antibodies and transport proteins. Then we're going to have the vast majority of that remaining 4% be clotting proteins, and then a smattering of enzymes and hormones. Now, if we have agitated the blood prior to spinning it in a centrifuge, we are going to have serum, not plasma. Serum is plasma that has had the clotting proteins removed from. Plasma, serum, clot.